Daughter, you know that as you get older you may start having feelings and desires about sex. This is completely natural and normal for someone your age. However, sex and sexuality is a complicated issue because it carries with great emotional weight and responsibilities. It can be scary and confusing. As you grow, your body changes and matures faster than your brain. As your parent, I always want what is best for you. You will hear or see information from other sources, but I want you to be careful about the sources you trust. I want you to know that when you have a question about sex or anything else, you can ask and I will give you the best answer I can give. So do you have any questions? Babies come from sex, which is when two people, a male and a female, come together and a male sticks his private area into a woman's private area and sends sperm into her, creating a fertilized egg that grows a baby in her womb.
How are girls' and boys' bodies different?
Girls' and boys' bodies are very different. Girls' bodies have a vagina and boobs, and guys' bodies have a penis and no boobs. They also have a different anatomy of their genital areas, although it's said that all fertilized eggs start off as female.
What is a period?
Before they come male or female. A period is something a girl or woman gets when her body thinks it's pregnant. It causes a lining to build on the outside of the uterus, which she then sheds, which is why they have blood and they use tampons. Yeah.
Is it normal to have sexual desires?
Yes, it is normal to have sexual desires. A lot of people are ashamed of it, but it is very normal.
Why do I sometimes get aroused for no apparent reason?
You get aroused for many different reasons, and sometimes you don't even know why. A lot of times you don't realize that you're thinking about things in the back of your mind, or also your body just reacts out of nowhere, and it's your hormones just acting or building up.
Is masturbation normal?
Masturbation is normal.
What are sexually transmitted diseases?
Sexually transmitted diseases, or STDs, are diseases that you can get from having sex or touching and having physical contact with another person. STDs can be spread orally, through the genital area, through both, and mainly are spread through bodily fluids. STDs can affect you in many ways, along with physical symptoms and rashes, but also with sick feeling and nausea and other things.
What should I do before I decide to be sexually active?
Before you become sexually active, you should talk to an adult or trusted adult or parent, and you should get to know what you're dealing with. You should also make sure it's the best idea for you, and it's not just out of loneliness or depression or any other things in your life. You should do it because you want to do it and because it's with someone special. You should also make sure you're fully prepared and you have protection, because you don't want to get pregnant unless you are trying, but you probably aren't because you're not trying to have a baby. You should do background research to make sure you properly know how to open a condom and do everything correctly so you can reduce the risk of STDs and pregnancy. Those were good questions. Now I have some questions for you to let me know that you know enough to make good decisions. Can you explain to me 3 forms of birth control?
You could use condoms or the pill or a female condom.
Can you explain to me how to reduce the risk of contracting an STD?
To reduce the risk of contracting an STD, you could use contraceptive, remain abstinent, or get a series of shots.
What will you do before you decide to become sexually active? What will you do before you decide to become sexually active?
Before I become sexually active, I'm going to talk to an adult. I'm going to make sure it's the best choice, and I'm definitely going to use protection.
I know this may have been difficult and a bit embarrassing, but I want you to know you can always come to me. Do you have any other questions I can answer for you now?
No.
I know this may have been difficult and a bit embarrassing, but I want you to know you can always come to me. Do you have any other questions I can answer for you now?
No.